This is Aksum Primary Healthcare Center in Aksum, Central Tigray. Sister Ngusti Gabrahewet, a nurse at the center, says that the hospital has completely run out of vaccination, putting the lives of thousands of children living in its vicinity.
Vaccination is essential for children, especially those under the age of 1, but we haven't been able to provide this for our patients because there is simply no supply. The child over here, for example, is 7 months old. He needs to take multiple vaccines, but all he's getting is paralysis.
She is 65 days old, and she didn't get any vaccination yet.
I came here so that my daughter could get her 6 months vaccination, but they said there is none available. Medical experts in St. Mary Hospital, another hospital in Aksum, says medical professionals have not been able to provide sufficient care for children suffering from malnutrition or any other diseases due to lack of medical supplies. Some health workers have in fact become so desperate that they've started to use expired medications to treat their patients.
7 to 10 children here are severely malnourished. Their body is swelling up. It would have been simple to treat them if it hadn't been for the severe lack of supplements, and now children are dying. We lost 2 children last week alone, just because we don't have enough medication. And we sometimes have to use medications that expired more than 2 or 3 months ago. We are desperate for supplies.
Mothers and children are severely malnourished. The numbers on malnutrition are very disturbing. There are more than 340 malnourished children in this hospital alone. In addition to the lack of medicine and vaccination, the lack of food items in the hospital is exacerbating the condition of patients at these hospitals.
There is no food here. They say they have nothing to give us or our children.
Our children are underweighing. This is because mothers are malnourished during pregnancy. But we also have a severe shortage of supplementary food that are needed to treat underweight children.
Dr. Solomon Harui, medical director at St. Mary Hospital, says lack of medicine and vaccines may have an impact on the health and well-being of a generation.
Children are not getting their vaccinations. This could have a major impact on a generation, resulting in a generational gap.
For almost a year, Tigrayans have been denied access to basics such as food and medication, resulting in a humanitarian catastrophe of magnificent proportions, sure to affect the health and well-being of generations to come.